So after the initial correction, there's certain things that you need to pay attention to. The whole point in doing all of this is that so you can live your life better. So I don't like to give a lot of restrictions with what you can and cannot do with your body, but initially there are some guidelines that you do need to follow. One of the main things that can throw your body out of alignment is talking with your phone cradled in your ear. It's very hard on your head and neck, and it's a big no-no. Going to the hairdresser and getting your hair washed backwards in the bowl is very hard on your head and neck, because what happens there is that they take your neck muscles out of the picture because your head's pulled backwards, and then they move your head around, the skull around, and it can actually change your misalignment or actually rebalance the skull again. So it's really important to go forward in the chair at the hairdressers, have them wrap towels around your head and just have your hair washed forward. Usually I recommend that you don't do any kind of working out for the first 7 to 10 days. And that's because we've basically taken you, when you come into the office, you're in a somewhat stable, crooked position. And we take you from stable and crooked and we put it straight. But for your body, for your system, that's unstable. And so we want to give it every opportunity to adapt to the new posture. And so working out, the muscles have a memory to them. And when you work out, the muscles will tend to pull back into that old posture, that old memory. And so we want to just take it easy on the working out for the first 7 to 10 days and not put the body under stress. What's also really important is, especially for men, is to not sit on top of a wallet, because what that does is it creates an uneven balance between one hip and the other. So it's really important to make sure that you keep the wallet in the front pocket, and then to check your shoes, the bottom of your shoes, because if you've been out of alignment for a long period of time, chances are your heels are worn unevenly between one shoe and another. And you don't want to wear those shoes, or you want to get them resoled, because when we balance you and you're even, and then you put that shoe on, it will actually act as a heel lift and it will throw you out of alignment. It's also important not to sit with your legs crossed, because again, that will actually cause the hips to be off, and we want to give your body every opportunity to adjust to the new position. Sleeping on your back is the best thing that you can do as far as sleep, or your side. I always recommend a patient bring in their pillow so we can check them on their pillow to see if their head is staying in a neutral position. We don't want their head falling down or propped up, because you're sleeping for usually 6 to 8 hours a night. So sleeping is critical, and having a really good mattress that supports your spine is very important as well. Along with sleeping, it's really important not to fall asleep on the couch with your head propped up on the couch, because that will also kink up the spine, and we don't want to do that. It's really important not to crack your own spine. A lot of people just get into the habit of it because they've had discomfort, and what that can do is create further damage. So you really don't want to do that, because you don't want to change your biomechanics, especially after you've had a good correction to your spine. And then after the initial correction, it's really important to lie down and just take it easy. I recommend usually an hour, couple hours if you can, just to let your nervous system calm down and incorporate the change. Also, as far as lifting goes, you don't want to lift any kind of heavy objects, and it's really important with lifting that you always bend your knees when you lift. And one thing that's really critical, and whether it's working out or doing any kind of light lifting, you always want to tuck your chin. And when you tuck your chin, what that does is it activates your trapezius muscles and a lot of the muscles at the back of your neck. And what they do is they actually stabilize the weight of the head. And so when you do any kind of strenuous type of activity, keeping that neck tucked in and locked will actually help maintain your alignment. It's critical after going to a dentist to get checked, any kind of heavy dental work, because there's a very, very intimate connection between the jaw and the neck. And so a lot of times if you've had your jaw propped open for an extended period of time, it will actually throw your neck out. And so a lot of my patients will have a dental appointment and then come in and see me the next day so that they don't have to experience any discomfort. The whole point of doing all of this is so that you can live your life better. And if you follow a few simple guidelines, you'll be able to do more instead of less.